Congratulations! You have received a very special message from the world record holder in surviving the most chemotherapy, Kyle Hannon, and the world champ of cancer patient with the largest biceps in the world. I am a sociopath against cancer. Thank you very much. So, the issue today of the BS articles throughout social media that are claiming that there is a world shortage of all chemotherapy drugs and thus children with cancer are gonna die. Some of the articles are not as sensationalized and are saying because of one pharmaceutical company, Teva, no longer will be producing the drug Vincristine, children will go out without chemotherapy that will save their lives. This is complete and utter false news. With Vincristine, it's a vinca alkaloid. It's derived from a plant, a flower, the Madagascar rose. Its sister is vinblastine. It was stated in these articles that Vincristine is used for all pediatric cancer patients, or most pediatric cancer patients. I saw both in different articles. This is not true. One of the top 10 pediatric cancers that children battle is Hodgkin's lymphoma. As we know, even up to the most recent NCCN guidelines, ABVD is still the first choice. And although that's changing very quickly, many clinics are now using monoclonal antibody combinations. So ABVD, the V in ABVD is vinblastine, which is a vinca alkaloid, but is not Vincristine. So there's no worries there. Next, we have probably the most common pediatric cancer is acute lymphoblastic leukemia. Acute lymphoblastic leukemia has many variations, many variables to it, and Vincristine has been used in combinations of other chemotherapies and different treatment regimens. The truth is, there are many options. If you look on cancer.gov to see the approved drugs, FDA approved drugs, even out of clinical trial, there's over 20 options of chemotherapy drugs that can be used in combination to fight pediatric acute lymphoblastic leukemia. Many of those options are rising up in the form of monoclonal antibodies. There's at least 15 monoclonal antibodies, MABs, those are the drugs that end in MAB, like nivolumab, brentuximab, that are being used to treat pediatric ALL. You will find many clinics are not using Vincristine. They do not touch Vincristine for ALL at any point in treatment for their pediatric patients. I believe that the media is sensationalizing this matter and is not clarifying that there are many options. If you look, then we need to look at the reason why there may be a shortage of Vincristine. Some of the hospitals are starting to ration Vincristine because of the reports. The reason is because of the changes in the advancement in chemotherapy. With monoclonal antibodies, they are being used with success to treat all forms of cancer, including for children, with less side effects and more success in targeted therapy. Thus, a lot of these clinics or doctors that are getting all hot and bothered about these reports that one company is no longer producing Vincristine, they need to catch up. They need to get with it. They need to look at the options. They need to get into using monoclonal antibodies. There should be no fear in the matter. And one thing that pisses me off about this, and what inspired me to write the article, is that articles like this bring fear into cancer patients and families of children that are battling cancer. If you read a report that there was a shortage of chemo drugs and my child may not survive, that is fear-inducing, and that we don't need that. It's already enough stress and enough fear to be battling cancer. You got enough going on. We don't need reports that sensationalize the report. The media doesn't care about stress on families or children with cancer. All they care about is making money. The majority of the media cares about sensationalizing and to the point of falsifying news. As we knew, they have, especially in the last couple of years, there's been many examples. And we just don't need that. So we need to stand in the truth against BS sensationalized reports like this. Now, there's another reason why Vincristine may not be produced. That's because it's pretty cheap to make. So, as I wrote my article, I think more of us need to get out in the garden, grow flowers. There you go. If everything else fails, you got your Vincristine chemotherapy cancer treatment. I submitted my article to several social media areas and under many threads of paranoid claims that kids were gonna die of cancer because of chemo shortage. And I submitted my article to different publications, so far to no success. And I received a lot of backflack from it. Not a popular stance, definitely. So got hate mail, been in some threads in multiple places with people that became very angry. And to them, all I say is facts over emotion. Look at the facts. Review the facts. Use basic logic. Are there kids dying of cancer because of a shortage of hundreds of chemotherapy drugs called Vincristine? No, there's not. And will there be in the near future? No. Now, if we start to get a shortage of more chemotherapy drugs, including the monoclonal antibodies, then I can see a case for it. And I defend the pharmaceutical company's decisions to no longer produce drugs that are not profitable, like Vincristine, because other companies could produce them, number one, and number two, there's just too many options out there now in the monoclonal antibodies that are much more effective. Also, most of these pharmaceutical companies are facing massive lawsuits against the same people who have their arms up in the air about a shortage of chemo. These are the victims in our society that believe that they deserve something extra and are blaming the pharmaceutical company for the treatments that saved their lives previously. As I pull into my cancer treatment center at Honor Health Scottsdale Shea, where I'm under treatment currently, and I'm on my way to an awesome gathering at the chapel here in support of staff and patient care. I also wanted to mention to not sign the petition that is floating around, one of the several petitions concerning the reports of chemo shortages. By signing the petition, you are only contributing to the false reports that are building fear in the families of pediatric cancer patients, and that is no good. So don't sign this garbage petition that's floating around. Something you can do is petition the health insurance companies to approve the new chemo drugs that they don't want to pay for. So that's all I got today. Thanks so much for watching. Kisses.